Welcome to The Explainer. So today we're diving into some really fascinating neurobiological research, but we're going to translate it into a practical, clinical toolkit designed specifically for you, the mental health professionals out there working directly with trauma survivors. We're going to explore this profound brain-body disconnect and really look at how to leverage somatic sensory processing to help your clients heal. It's like mapping out the intricate pathways of the nervous system, so let's build this framework together right now. I want to kick things off with this incredible quote from neuroscientist Jock Pinksep. It perfectly sets the stage for everything we're talking about today. He says that the spreading branches of a tree cannot function or survive without the nourishment of the roots and trunk. For those of you in the therapy room, this is your script. It's such a brilliant, vivid way to explain to clients why cognitive top-down talk therapy, the branches of the mind, can sometimes just feel totally stuck if we haven't first nourished the roots, meaning the physical body and the ancient brainstem. Okay, so let's look at our roadmap. We've got 5 sections to cover. 1, the brain-body disconnect. 2, the vestibular system and safety. 3, the impact of chronic neglect. 4, spotting client sensory overload. And finally, 5, somatic tools for self-regulation. Let's jump right into section 1, the brain-body disconnect. Okay, so the core of this whole disconnect is what we call somatic sensory processing. Basically, this is the brain's capacity to register, organize, and modulate incoming information just to understand how the physical body literally exists in space. When trauma happens, especially chronic early life trauma, this processing totally derails. When you're explaining this to a client, you can completely reframe it for them. Tell them it's not a broken brain. Actually, it's a brilliant, if slightly outdated, survival mechanism. Their brain literally severed the connection to physical space to protect them from overwhelming pain or inescapable threat. It was an adaptive shield. It just, kind of outlived its usefulness. And because of this, we see 2 extreme client presentations in the therapy room, probably every single week. On the one hand, we've got bottom-up overwhelm. This is your classic hyperarousal PTSD presentation. The brainstem is just flooded with unfiltered sensory data, leading to that exhausting state of feeling too much. But on the flip side, we have top-down overmodulation. Think dissociative subtype. The higher cortical regions clamp down so intensely on the lower brain to suppress all that terror that the client is left in hypoarousal, feeling numb, detached, or just dead inside. Honestly, it's absolutely wild to realize that the exact same underlying sensory processing deficit is responsible for both of these completely opposite extremes.
Moving right along to section 2, vestibular system and safety.
I want you to think about this for a second. What sensory system never sleeps? I mean, you can close your eyes to block out light, you can plug your ears to stop hearing sound, but there's one system that is perpetually active, constantly grounding you, and really forming the absolute bedrock of your sense of safety. Any guesses? Well, it's the vestibular system. Tucked way deep inside the inner ear, this system is constantly detecting the linear pull of gravity. And because gravity is this omnipresent, totally unchanging force, the vestibular system acts as our earliest, most reliable anchor to reality itself. What's absolutely fascinating here is how deeply wired this is into our survival mechanisms. It connects directly to the autonomic nervous system. It actually modulates breathing and heart rate fractions of a second before we even formulate a conscious thought. When you trip and stumble, it's your vestibular system that catches your breath and spikes your heart rate to save you. It's the literal bedrock of baseline security. Let's transition into section 3, the impact of chronic neglect. Let's look at how this builds, literally from the bottom up. By just 1 month in the womb, the structure of the vestibular system is completely mature. By 8 months gestation, its nerve myelination is totally complete. This means a baby is born incredibly sensitive to movement and touch. Now, in a healthy environment, a caregiver's soothing touch and rhythmical rocking regulate that infant's brainstem. But look at what happens with chronic emotional neglect. In early childhood, if those subcortical regions are starved of that crucial soothing somatic input, the rapidly developing brainstem is severely compromised. Fast forward to adulthood, and this starvation manifests as altered neural defense circuitry. The roots were never watered, right? So the branches of the mind grew up incredibly vulnerable to trauma and PTSD. This brings us to section 4, spotting client sensory overload. Okay, here is the absolute crucial takeaway for your practice. These nonverbal clues tell you exactly when talk therapy temporarily needs to hit pause. When a client gets triggered, their ancient sensory systems totally bypass the logical brain and jump straight into a pure survival response. You might notice an exaggerated startle to a tiny sound out in the hallway. You might see heightened muscle rigidity or postural freezing, what neurobiologists call tonic immobility. Or conversely, you might see sudden flaccidity, like a collapsing of the spine, or even breath holding, which mimics that evolutionary feigned death response. Spotting these specific cues tells you instantly that your client is trapped in the brainstem and completely disconnected from the present moment.
Now for the highly practical part. Section 5, Somatic Tools for Self-Regulation.
Because the trauma response is so deeply rooted in the body, our interventions absolutely have to start there too. We need to give clients back their sense of physical agency. Step 1 is simple: mindful attention to current posture. Just having them notice where their body is in space, without any judgment. Step 2 utilizes that vestibular system we were just talking about: rhythmical linear rocking. Gentle, repetitive back and forth motion completely bypasses the overwhelmed neocortex to directly calm the brainstem's alarm centers. Step 3 is deep touch pressure. We know for a fact this increases parasympathetic activity and immediately drops the heart rate. And finally, step 4, trauma-sensitive yoga movements. This guides the client to take intentional, self-directed action with their physical form. Look, these aren't just band-aid coping mechanisms. They are profound neurological interventions that rewire the brain from the roots up. We've covered a tremendous amount of ground in this explainer today. We've tracked how trauma and neglect fundamentally disconnect a survivor from their physical space, and exactly how we can use the vestibular and somatosensory systems to bring them back. So I'll leave you with this final provocative thought. If trauma disrupts our very foundation, how will you use the roots of the body to heal the branches of the mind in your next session? Thank you so much for your focus today, and honestly, for the vital, life-changing work you do with your clients.